My name is Claire. I'll be performing my IV skills video. Be performing IV push, IV piggyback, IV primary, and an IM injection as well. So I'm going to start by entering the med room and perform hand hygiene, and I will review the orders, the different medications, the dose, the route, the rate of the medication, make sure it's the correct date and time, and I will review the medications to make sure they are appropriate for the patient's situation. I'll review her chart for allergies. It looks like she is allergic to mangoes, so none of the medications are contraindicated with mangoes. Then I will go ahead and get my supplies set up. So I will start by hanging the IV bags. These are all new, clean, sterile supplies, just for demonstration purposes we're reusing. Prime the IV tubing, removing air bubbles. Filling up the chamber halfway. All right. That's primed. Bubbles are removed. Just going to maintain sterility and set that out of the way. And go ahead with the secondary bag. So this bag was normal saline, and this is ciprofloxacin, 200 milliliters an hour, 400 milligrams, and we'll hang that. This will infuse first. Spike this bag. Make sure there's a good seal. Okay. It is clamped. And squeeze the chamber. Make sure it's about halfway. And we'll prepare my injections. So it looks like she has an order for ondansetron. So insert 2 milliliters of that. Okay. Pop the top of the cap off. And my alcohol swab. Swabbing for 30 seconds, 27, 28, 29, 30. And the order is 2 milliliters. Pull back 2 mils of air. Okay. Push the air in, invert. Withdraw 2 mils. Okay. So no air bubbles. Carefully taking care of the needle. This is my danzatron. It's ready to go. Maintaining sterility. Good. Now I'll get my flu injection. So this is for 0.5 milliliter. I'll put the cap off. Scrub the top 30 seconds. 27, 28, 29, 30. This is for again 0.5 ml. Gonna withdraw 0.5 ml of air. Push the air in. Draw 0.5 ml, removing bubbles. Okay. That's ready to go. Right, so my bags are ready. My injections are ready. And now it will just make sure I have all my supplies. I'm gonna knock on the door. Move my camera here. Hi, my name is Claire. I'm going to be your nurse for today. Could I get your full name and date of birth? Arena Tract, February 1st. And 2000. And just going to check your wristband. Perfect. For my hand hygiene, provide privacy. And so today we're going to do your different injections and your IV. So you're going to have a normal saline IV running just to keep you hydrated. And you'll also have a ciprofloxacin antibiotic for your UTI. Side effects of that may include nausea. For that nausea, we're going to treat it with ondansetron, just in your IV line. And that has a side effect of constipation. We're also going to give you your flu vaccine. That will hopefully help prevent you from getting influenza. And side effects might just be a sore arm. And if you have any other questions, feel free to let me know. Just going to go ahead and get started. And I just want to verify your allergies. Allergic to mangoes. Again, not a contraindication. So I bring my supplies into the room. My IV pull into the room. And really just perform hand hygiene again before I put my gloves on. All right, so her IV is already in her arm. I'm just going to check the IV site for patency, making sure there's no infiltration or erythema, making sure she's not in any pain or discomfort with that IV. Just going to raise the bed to a comfortable working height. So the IV looks good. I'm going to go ahead and give her ondansetron push, bolus, if you will. I'm going to flush with 3 to 5 mLs of saline before and after, and I'll give the ondansetron over the course of 2 to 5 minutes. For demonstration purposes, I'll be giving it a bit faster than that. Maintaining sterility. Removing the caps. Okay. Put in 4 mils of saline before. Okay. You experiencing any pain or discomfort with that? So maintaining sterility. Go ahead. Insert the ondansetron over a rate of 2 to 5 minutes. Okay. It's been 2 to 5 minutes. Going to remove that. And just flushing that with 3 to 5 mils. I'll put in 4 mils. Okay, that's done. All right, so now we'll go ahead and start with the IVs. Okay. Go ahead and scrub the hub here. 25 or for 30 seconds. Set in 28 to 9:30. IV bag is already primed, it's ready to go. I will remove the cap. Push it in. This is at a lower level because the piggyback will go through first. And the rate is 5 drops per 15 seconds. Also, I'm going to take the piggyback, move the cap, maintaining sterility. Just going to back prime it to remove that air. Those air bubbles moving out of the way. bubbles are gone. Okay, so this ciprofloxacin is 8 seconds or 8 drops per 15 seconds. So I will get that started. On this one. Okay, that looks to be 5 drops per 15 seconds. Okay. This one's a little bit faster at 8 drops per 15 seconds. Okay. And just making sure it's all infusing properly. Making sure there's no air bubbles. And how does that feel? You feel okay? Okay. And at this point, I've done my IV push, done the piggyback, done the primary. Primary is hanging lower than the piggyback. And now I will get started with my injection. Just gonna change my gloves. Performing hand hygiene. And so since this is a vaccine injection, it will be using the Z-track method. And I'll identify an area on the upper arm below the acromion process. On here. I've identified a good spot on her upper arm. I scrub the arm with alcohol for 30 seconds. 27, 28, 29, 30. For my influenza vaccine here, 0.5 mLs. Using the Z-track method. Needle is not going all the way in, but in reality it would. Right, insert. Well, and dispose of this in my sharps container. And at this point, I would document everything I just performed, the injection, where it was, the 3 IV pushes, primary piggyback, the rate, the dose, time, how the patient tolerated it, the condition of the IV site. And I would label the bags. And at this point, I would discard of my supplies, remove any biohazard, any sharps, and put her head to a low position. Patient's in a safe position and highlight is within reach. Is there anything else I can get for you? Okay. And we'll continue to reassess the IV site. Thank you.